So Dr. Mascarenhas, one of the things that you asked me about was how did I describe my symptoms when I was first diagnosed? How do you ask your patients what about their symptoms?
So first I try to set the stage of what myelofibrosis is in terms of it's a disease, the cells it originates at a stem cell level, the fact that it's considered a cancer because of its properties, that's driven by mutations that are acquired in those cells, and it's a very inflammatory disease. And I think that becomes critical, that patients understand it's a complex disease. I think it's a complex disease for physicians to even wrap their heads around, more or less, a patient who's experiencing these symptoms. And then I'm really quite dogmatic about going through all the different types of symptoms and making sure that not doing the open-ended question, because you miss a lot, I think. You can start with the open-ended question, but then I think you really need to ask those questions, and go through the different symptom burdens that are included in the TSS 50, the TSS, for example. And sometimes we'll have a patient fill out the total symptom score themselves. And I think it might force the patient also to think about and reflect about some of the symptoms, because sometimes you catch patients off guard if you ask them, about fatigue level. And the way you ask the questions may not always resonate with the patient. They may not always get what you're trying to ask. And one of the things that you and I have talked about before is that sometimes you get an answer like, sure, I feel fatigue, but it really steals like the significance of what that fatigue really means to the patient. So I think it's important to not just, ask, are you tired, do you feel fatigued, but how is that impacting your quality of life, your functionality? Is it taking you out of work? I find that happens very frequently. Is it taking you out of social situations? And the more people are isolated and less engaged with other people, I think that patients don't do as well. So all of these things sort of matter. And if you don't ask the questions in the right way and sort of take the time to understand what those symptoms are doing to the patient, you sort of miss a lot of that.